The menopause is a natural transition that every woman goes through. Some women don't have any problems during the menopause transition, but for others, the change can cause unpleasant symptoms such as hot flushes, brain fog, and vaginal dryness, affecting quality of life. In this video, I will discuss the symptoms of menopause and how to alleviate them. I am Dr. Vivek Nama, a consultant gynecologist at Shirley Oaks Hospital in Croydon. I have been treating patients with menopause and perimenopause symptoms for over 10 years, so you can trust my knowledge on this subject. What is the menopause? Menopause is a natural stage in every woman's life, and that occurs when your hormone levels drop and your ovaries stop making eggs and your periods stop permanently. The most common age for menopause in the UK is 51, and most women go through menopause somewhere between the age of 45 and 55, although this can vary. What are the stages of menopause? Menopause is not a single event, but a transition that can last several months or even years. Menopause has 3 stages: peri-menopause, menopause, and post-menopause. Peri-menopause is the first stage of the menopause. Peri-menopause starts a few years before your last period, lasting few months to up to 10 years. Studies have shown that perimenopause can start as early as 38 years of age. During this time, your hormone levels drop, causing your periods to become less regular. Menopause is medically diagnosed when you haven't had a period for over 1 year. When you're in menopause, your ovaries are no longer releasing eggs and your periods have stopped permanently. Post-menopause describes the years after menopause that has occurred and is the last stage of menopausal transition. The symptoms of perimenopause and menopause should gradually start to improve during post-menopause, though some symptoms may continue until your hormone levels stabilize. Reduced levels of estrogen in postmenopause increase your risk of osteoporosis, also known as brittle bones, cause painful sex, and repeated urinary tract infections. What are the symptoms of menopause? Menopause symptoms can vary widely, ranging from mild to a significant impact on life. Some common symptoms of menopause include changes to your periods. Often it is one of the first signs of perimenopause. A decrease in the female hormones, estrogen and progesterone, means that your periods may become less regular, lighter, heavier, or your cycle may become longer or shorter than before. Hot flushes cause sudden heat, redness, sweating, and sometimes dizziness. Hot flushes normally last between 2 and 5 minutes and may be followed by a period of chills and shivering. Though they are unpleasant, hot flushes are not harmful and are thought to be due to a drop in estrogen levels that affect the body's ability to regulate its own temperature. Night sweats and sleep disturbance are common during menopause. You may experience difficulty falling asleep, staying asleep, and a poor quality sleep. Menopause fatigue is a severe form of tiredness that can severely impact daily life and is linked to hormonal changes, stress, and sleep disturbances. Mood changes are common and may be related to serotonin fluctuations, a neurotransmitter responsible for regulating our mood. Brain fog or difficulty focusing and forgetfulness is common. It may be related to hormonal fluctuations as well as difficulty sleeping during this time. Brain fog is temporary and will usually resolve over time. Lower levels of the female hormone estrogen during the menopause can cause the vagina to become drier and less lubricated. It can also make the walls of the vagina thinner and less elastic. This can make sex painful, leading to tearing and infections. Thinning of hair and dry skin is also common during the menopause. Estrogen helps keeps the skin plump and hydrated by helping the skin to retain water. It is also important for hair growth. When estrogen levels fall during the menopause, you may find that your skin becomes drier and your hair thinner. Reduced levels of estrogen change the way your body stores fat, and you may gain weight, especially around your tummy. Your metabolic rate also slows down during the menopause, meaning you may gain weight even if you eat the same amount as you did before the menopause. When should I see a doctor? Seek medical advice if your symptoms are making it difficult to carry out normal activities, negatively impacting your relationship or affecting your quality of life. How are the symptoms of menopause treated? Menopause symptoms can be treated with lifestyle changes, cognitive behavioral therapy, hormone replacement therapy, and non-hormonal medications. Menopause is a natural part of life, but that doesn't mean that you should put up with distressing symptoms. Talk to your GP or to one of our specialist consultants to ensure your transition through the menopause goes as smoothly as possible. So that's a brief guide to menopause symptoms. If you have any more questions, please feel free to leave them in the comment section below. If you would like to arrange a consultation with me or another consultant in your local area, give us a call or book an appointment at circlehealthgroup.co.uk. Thank you.